Well, welcome everyone. Thank you for being here. I do know that, this is, as I said earlier, probably the first event for many people. So please feel free to take a note from Josephine and do whatever makes you comfortable, mask, no mask, food, whatever. But please do enjoy food cooked by someone else other than yourself in your own kitchen. Just to kind of kick things off, I just wanted to start by acknowledging that there's probably a range of experience in this room around early childhood, and we'll try to kind of accommodate people who've been immersed in it and it's their day job, and also kind of if this is your first toe in the water, welcome, and please slow us down or stop us if anything is going over your head, because this is a field where there's a lot of acronyms. It's an alphabet soup, and we want to make this more accessible to everyone. So the goals of today's event is really about access and also just connecting with other colleagues, learning about new approaches, and maybe just better understanding the landscape of what's going on in early childhood. We're going to hear from 4 different panelists from 3 organizations who are doing pretty extraordinary work in this space, and really trying to kind of fundamentally change what the landscape looks like in early childhood. But before we kind of move to our panelists, we thought maybe we'd spend just a second level setting and talking about what we mean about early childhood. So when we say early childhood, what does it mean? So first of all, for today's purposes, we're referring to children 0 to 5 and their families. And generally, when you talk about early childhood, the idea of early care and education comes to mind. That's a big piece of it. But we're also talking about things like early intervention, parental education, pediatric health care, home visiting. So there's a really broad range of things that the field of early childhood kind of encompasses. Unfortunately, early childhood has, for a very long time, been a pretty neglected area in philanthropic investment, government investment. Most of the focus has been around K through 12. What's interesting is that science around early childhood has actually been pretty rapidly evolving, and we now know that this period of 0 to 5 in a child's life is incredibly important and basically lays the foundation for everything in a child's life going forward, including later academic outcomes, but also things like health and wellness. Equity issues are all tied to early childhood. So there's kind of a lot that comes together in early childhood. Unlike the K through 12 system, early childhood really isn't necessarily a system. It's kind of a lot of different pieces put together, daycare facilities, preschools, home-based family care, as well as kind of all these other pieces that I mentioned, like home visiting. So one might actually call it a sector that's in a bit of disarray as opposed to a system. And over the past 2.5 years, COVID's really highlighted how little of a system there really is there. Many of you probably read articles in the past 2 years highlighting the challenges families have when they had children, like young children. Nonprofits have been working a long time to kind of to build this space. So although there's been an underinvestment in it, a lot of nonprofits have really learned a lot about what does work. And that's exciting because as we come out of the pandemic, the landscape has now changed. And so we know some things that work. We have some groundwork laid. And it's really kind of an exciting and urgent moment for this field. I also just want to highlight how many issues are connected to early childhood. So if you're interested in poverty, in brain science, in gender issues, race and equity, healthcare, education, they all come together under the banner of early childhood. And so this is really kind of an exciting space and an everyone type space. So today we're going to hear from these 4 panelists, and they're each going to highlight a specific project that they've been working on and kind of changing the field with. I'll start by kind of introducing them. So we have Elizabeth Pauley here, who's the Associate Vice President for Education to Career and Health and Wellness at the Boston Foundation. And we have Turahn Dorsey, who's Foundation Fellow at the Eastern Bank Foundation. And then we have Lydia, Icke, and Melora Balson, who are both co-founders of the Commonwealth Children's Fund. So welcome, everyone. And I am going to ask our panelists to pass down the microphone. I'm sorry, but we are recording this, and it's a little easier to hear. So let's get to it. So I'm going to start by asking you each to maybe explain how you entered the space of early childhood. But then also if you could then tell us a little bit about the project that you want to highlight that you've been working on in early childhood. And what would be great is if you could each maybe put a lens around the end user that your project is focused on. So who do you want to impact with these projects? And Elizabeth, I'll start with you.
Thank you, Dr. Kendall. Well, good morning, everyone, and I'll be brief so that we can get into conversation. That means I'm going to throw a lot of information at you quickly, and if it's too much, please see Danubia, or for that matter, Brian, our early childhood program officer and our previous early childhood program officer. So I'm here representing the Boston Foundation, and we are the Community Foundation for Greater Boston. For a long time, we did not invest in early childhood. Most of our focus was on K-12. We then expanded our focus in post-secondary. And the reason we did that was because we believe that our regional economy holds opportunities for people with a post-secondary credential. But we stayed away from early childhood. And frankly, even at a time when our donors were not. We have a robust donor base who have always been invested in and interested in early childhood and didn't need brain science to know what common sense would tell you, that it makes a big difference to invest early and to get kids started on a success trajectory right from the start. So in 2015, which was the last time we did a strategic plan, our board said to us, enough is enough. We can no longer afford to say we cannot afford to invest our discretionary resources in early childhood. There is too much evidence, our donors are too interested in it, and we have amazing pilot efforts, we have amazing things happening in Boston and Greater Boston. But what we also have is a fragmented system that is largely supported by soft dollars, by inconsistent public dollars, and so we believed we could make a difference in the space. So we entered the space first through our health strategies, believing that we could help babies and young children get off to a healthy start in life that would ultimately prepare them for first success in kindergarten and then eventually success in life by taking a health lens. So the investment that I wanted to talk about today, and we can dig more deeply into as you're interested, is in a program called Healthy Steps. So Healthy Steps is a national program, and by the way, for you history buffs, apparently the Boston Foundation in the 1990s provided the seed money to start Healthy Steps, which I did not know, when we invested in it a few years ago. But Healthy Steps is a child development support system that is housed in pediatricians' offices. So with equity in mind, we wanted to go where we thought parents were. And what we know about parents is parents bring their babies to those well child visits. There are 13 well child visits in the first 3 years of life, and over 90% of families bring their babies to the pediatrician for every one of those visits. And that transcends race, that transcends socioeconomic status, that transcends just about every measure you would look at. So when we thought about the system that most families were connected to, recognizing that this is a fragmented system, we thought the pediatrician's office, that's where families are. So if we want to help them help their babies, that's where we should go. So we found Healthy Steps, which is a program of 0 to 3, which is a national organization, and they provide child development specialists in the pediatrician's office. So for those of you with young children or who remember having young children, you might remember that the pediatrician comes in and has 40 million things that she has to get through with your baby to measure their physical health and their developmental health. They don't have a lot of extra time to answer questions about sleeping, about is my baby on track? Is my baby eating? We don't have a high chair. And so the Healthy Steps specialist comes to the well baby visits and has more time with the family to meet whatever need they're presenting with. Do they need a referral to early intervention? Do they need additional supports or SNAP benefits? Do they just need to know how to do serve and return with their baby and games they can play? And so that Healthy Steps specialist follows the families and works with them between birth to 3, which was the area that we knew we wanted to focus in. Nationally, Healthy Steps has found that having a Healthy Steps child development specialist reduces maternal depression, increases the success rate of early intervention referrals, increases healthy eating, and there are other measures too. They're all over the country. The largest site, I believe, is in New York City at the Montefiore Hospital System. So it makes sense that if there's additional capacity, there'll be additional help for the parents. So we invested in Healthy Steps at MGH Chelsea. We made that grant in December of 2019. You might recall that as the calendar turned to 2020, Chelsea became the epicenter of the COVID-19 pandemic. And so it was slow to start. But they have started, launched, and they are well on their way. They hired 3 child development specialists that work with 700 families. Some of them need a lot of supports, some of them just need a little support and a friendly face that stays with them. So we're very excited to see what this will translate into in terms of child wellness. So when you ask about who the end user is, ultimately, we want the children and families to be healthier. We want children to arrive in kindergarten having met their developmental milestones. But who we want to change is the medical system that serves children and families so that they have additional capacity to think in a more holistic way about their the supports we provide. I've gone on longer than I intended, but I would be remiss if I didn't mention that programs like Healthy Steps and another one called Team Up that has been supported very robustly by the Smith Family Foundation and the Klarman Family Foundation for years. They do something similar in terms of integrating mental and behavioral health supports into pediatrics so families can access whatever supports they need for their babies. Most of these programs are funded by philanthropic dollars. And so it is hard to build a system that is solely funded on philanthropy. Philanthropy, I think, is critically important, and we'll talk about this later, in terms of making the case, in terms of risk capital, in terms of innovation. But in terms of building a system that's going to serve all children who need it, that's a tough sell, I think, for philanthropy. So when we looked at Healthy Steps, we thought, okay, Smith and Klarman have led the way on this. Let's partner with them to see if there is a way to build some sustainability into the system. So our companion grant to Healthy Steps was to Healthcare for All, which is a leading healthcare advocacy organization in Massachusetts. And they have been working very closely, Mass Health might say relentlessly, with Mass Health to find a sustainable, reimbursable path using public dollars. So I'll just add this last thing, that every 5 years, the Commonwealth can apply to the Centers for Medicaid and Medicare for a waiver around the rules of the road for Mass Health. So what will be covered, what won't be covered, how will the funding flow? Healthcare for All has been advocating, with support from Smith, Klarman, and the Boston Foundation, to make programs like Healthy Steps and Team Up a reimbursable expense so that this can become the standard of care, that every family can have somebody at their pediatrician's office that helps them with these other supports that they might need. So when you talk about the end user, we want healthy babies. But when we talk about the people we want to change, it is the way pediatricians work with children and families. And we believe that will not only lead us to greater health equity, but will also help children be ready for kindergarten. And I will pass the mic.
That was not a sign that you should pass the mic. But I do actually want to kind of, before I let Ron no, go ahead. But before, I think that the way you ended was such a wonderful lead-in to Ron's project, which is very heavily policy focused and thinking about the systems that we do have around early childhood. So I'll let you, maybe you can talk a little bit about that project and also, where Elizabeth started with the how did we get into this space. Would love to hear that from you as well.
Sure. Thank you, Dr. Kendall. I haven't done this in a long time, so first I need to make sure I'm not still on mute. Thank you. But it is good to see everybody and good to see a lot of friends in the room, old and new, and to be together. I get to represent the Eastern Bank Foundation this morning, and John Bernstein, thank you for your representation here for the coalition.
Ron, thank you for all the help. It's been awesome.
Not a problem, my friend. Tom Weber is not here, so he's not here to fact check me, so take my word on anything that I say here, and we can double back on it. In 2018, the Eastern Bank Foundation declared that early childhood development would be a focal point. And if you know anything about the foundation, most of its focal areas were annual focal areas. So kind of switched topics on a year-to-year basis. But 2018 was the year that the Eastern Bank Foundation said, no, we're going to settle in a little bit and start to dig in on some issues that are related to economic mobility and inclusion in the region. And when we say the region, we're talking about Eastern Massachusetts, Southern New Hampshire, and parts of Rhode Island, which is where we're based on the commercial side of our work. So wanting to make sure that we are also giving back to those communities that we're doing business in as well. We had already founded the Foundation for Business Equity, which was focused a lot on strengthening small business ecosystems, especially giving support to businesses and founders of color. But there was a conviction that, and I think John and others will agree with this, to focus on early childhood was, first of all, about the workers who come to Eastern Bank and to other employer settings every day and making sure that we take care of them. Secondly, it was an investment in the future workforce, making sure that we got every child off to the right start. What we were scratching our heads about was if the brain science was mostly settled science, if we know what the conditions for powerful programming look like, why were we not doing more of it? And so, as we dug in and kind of understood the state of the state, the balkanization of the system, if you can call the system a system, I would say the social justice imperatives where you have a significant number of women of color who are making wages that are below what it takes to live anywhere, much less the state of Massachusetts. How could we start to create a sustainable sector that delivered on the quality that we know early childhood providers can provide, wherever you may be, school-based, community-based, et cetera. So 3 areas that we're kind of focusing on, and they've morphed over time. With none of us having anticipated the pandemic, there was a lot of pandemic response that we had to do. But through that, one, we've wanted to make sure that we continue to expand the capacity of high-quality seats in the region. There are some providers who are doing incredible work, and as we saw classrooms and whole centers collapsing, we wanted to make sure that those folks who still wanted to expand had the resources to do so. So we've been doing a lot of capital and expansion work. We've also been doing a lot of innovation work. I think it was, our conclusion and that of many other folks before the pandemic that there needed to be, if not a reinvention, an invention of the early childhood system. And so there needed to be some R&D dollars and philanthropy in particular needed to be bringing risk capital to the enterprise of inventing the early childhood system. So we were on board for that. We are doing a little research and dissemination very reluctantly because we didn't want to get in a space that would have us back at the table debating brain science with folks. Stuff that ship has sailed. We know how powerful this is. So what are we looking for out of the research to give ourselves permission to do something about it? We really shouldn't be, but there are contemporary questions, especially on this side of the pandemic, about the market impacts of the collapse of early childhood, workforce implications, and some other things. Those questions we're very interested in and are trying to pursue. But as we really thought about the innovation imperatives, we got into a conversation with several of our partners, including Melora and Lydia, because what I'm about to describe to you, they were in it before we were in it. They just confirmed that we needed to be in it. Probably at the end of 2021, Commissioner Samantha Eigner-Treworthy was really having a series of conversations about what the invention of the system needed to look like. Tom Weber and I had been in some conversations with her about the public-private trust. There was going to be some blended capital to do some things. That didn't quite come into focus. She had some ideas about workforce that didn't quite come into focus, but then she landed on an idea about creating a grant program that would better help providers meet the cost of doing business. And so this was called the Commonwealth Cares for Children grant program, otherwise known as C3 or stabilization grants. Long story short, two components to the grant program. One, it is about the capacity and the staffing and making sure that you have the resources that you need to cover the people who are working in your program and to cover some of those operational costs. The second component of this is about an equity calculation. So if you are either serving a population that receives subsidy or you are located in a socially vulnerable community, usually high poverty is one of the linchpins of that index, then there is a special reward for you in this grant program. This was really kind of meant to put something on top of subsidy payment, again, to get closer to the cost of doing business. We were interested in this because from the beginning, we were trying to figure out how is this sector going to be economically sustainable over time. There does, and let me be really clear about this, there does need to be some reinvention of the business models that support this. But the C3 grants, from our view, were probably the first attempt at something pretty revolutionary in the financing system in early childhood. Whether it worked out or not, we wanted to be a part of it. There needs to be a habit of taking calculated risk. And so we wanted to be a part of that. Flash forward, now we are learning about the impact. A lot of providers applied for grants, did wonderful things with them. Some paid their workers, some created bonus pools, some did some other things. It's interesting when you talk to providers in Boston, and it's because people are anticipating whether or not there will be a funding cliff for the grant. You aren't seeing much go into personnel because they don't want to get to a place where now they've offered higher salaries and bonuses and can't do it again under their own power. So we're using a lot, we're learning about how this was used. But now there is a second attempt to kind of tweak the formula. The governor put $450 million in his budget proposal to continue this. The Senate put $250 million in their proposal to continue this. So fingers crossed that there is some reconciliation that will continue this. There is a path to institutionalization on this that I think we have to continue to follow and make sure that we learn what the power and maybe lack thereof of this grant program has been, but we will need time to do that, and we will also need to feed the sector the resources that they need. The last thing I'll say from a philanthropic standpoint, this hit it out of the ballpark for us. I can't remember how much you guys invested, and thank you for bringing us to the investment. Third Sector Capital did the work. You may know them from a lot of their Pay for Success work, but we put $170,000 into this investment. And I think Katie helped me calculate that we got about a 2,000% plus ROI on this because it was immediately followed by $314 million of ARPA money that was invested in the pilot. We may never do that well again at the Eastern Bank Foundation. That is high leverage, but that is now the goal.
Thank you, Ron. One quick follow-up for you. So just from a philanthropic perspective, the 170 that you said that you invested, what was that doing? Like, where did that go and how did it unlock the additional money?
So this was invested again in Third Sector Capital to create the formula that drives the C3 grant. So when I talked about this calculation of capacity and staffing coupled with an equity calculation, the combination of our two foundations paid the team that calculated that formula. And I think we're back at the table again now, helping them or funding them to tweak the formula.
Awesome. Thank you. And I think your project is actually a really wonderful comparison to what you guys have been doing, Lydia and Melora at the Commonwealth Children's Fund, which is actually much more kind of on the ground and very different looking from what Ron has just described. So maybe the two of you can describe the work that you've done with neighborhood villages and also in the same way, maybe lead us a bit into how you got into early childhood in the first place.
Definitely going to need both of these because we don't ever do anything one at a time. I'm Lydia Icke, and along with my dear friend Melora Balson, we make up the Commonwealth Children's Fund. And so Melora and I have been friends for 30 years. Don't do that math, but 30 years. And in various capacities, we've worked in K-12 education, both professionally, philanthropically, and on a volunteer basis. And we realized pretty early on that if you're trying to make an impact on children and improve their lot in life, kindergarten's too late. Like the more you get into it, the more you realize the change has to happen, the innovation has to happen in the early years. And so we came to that realization separately and together, and about 5 years ago formed the Commonwealth Children's Fund, which is a foundation focused on early childhood in Massachusetts. And we had a year of due diligence before we began our grant making. And in that year, we sort of realized two things pretty quickly. One, when we were trying to learn about what early childhood philanthropy looked like in the Commonwealth, it was slim pickings. You know, there just was not a lot, there were not a lot of foundations doing this work specifically, and there were not a lot of dollars flowing into the space, number one. Number two, it was an incredibly complex system, non-system. We've heard it, you've heard it multiple times now. But it's a tough field to find your way into as a philanthropist. And so those realizations allowed us to sort of figure out how we were going to pilot our own work. And where we figured we could learn the most is in supporting organizations that were kind of trying to build infrastructure for families in early childhood. So what that looked like on the ground for us was we made a couple of grants to actually municipalities. We made grants to cities who were building early childhood infrastructure. So we found that there were a lot of people working in early childhood doing amazing, like yeoman's work, but they were not connected. They weren't connected. Everybody was siloed. And that connection, that infrastructure just didn't exist. And so some of our early work was to a couple of municipalities and to neighborhood villages, who's, they're, and we'll talk about that in a minute, but it's this focus on sort of building out administrative functions and neural connections among and between all of the people working so hard for young children and families. We also, in our travels, realized the scope of the problem is massive. And as you've heard both Ron and Elizabeth say, the public policy solution is the solution. I mean, it's too big a nut for philanthropy alone to crack. And so we have also funded public policy and advocacy. That you've heard from Ron. We helped to fund the C3 formula, we call it. And we fund the Massachusetts Advocacy Organization's Strategies for Children and Common Start Coalition. So there's a lot going on in the advocacy side of things. And to address the sort of lack of philanthropic coordination, Melora likes to say it's our side hustle, but we have helped to form the Massachusetts Early Childhood Funder Collaborative, and who's co-sponsoring this event. And it's really twofold. It's, one is to sort of amplify the philanthropic dollars that are hopefully, going to start and have started pouring into this field. And also, just selfishly, like, it's a lot more fun hanging out with people to sort of, noodle on solutions. And it has been sort of a really wonderful way for us to have, enhanced our work. So that's me. Now you.
Now me. A couple things. One is that the very first event that I ever went to that was early childhood focused, right after we made the decision that we were going to see if we could make this our day job in some kind of way, was really at the time that the Boston Foundation was ramping up. When they decided to go in to early childhood, like all things that the Boston Foundation does, they did it well and they did it big. And that involved a lot of convenings. And so they ended up just sort of being the resource, continue to be, but started, I guess, in 2016, 17, with a lot of convenings that ended up really being, that's sort of how we learned anything we learned. That was our research early on, sort of what's going on in the field. And in fact, the first speaker I ever heard was Ron Dorsey. So this stuff is coming around and around and around and around, and you're now looking at the steering committee of the Early Childhood Funder Collaborative. So this stuff has, the reality is we do all of this work very collaboratively, and it's how we found our way through the sort of the wilderness that is, how on earth do you fund this stuff? So one of the things one of our very, very, very first conversations was actually with Lauren Kennedy from Neighborhood Villages, who was describing they were sort of they were being birthed at the same time as the Commonwealth Children's Fund was, and both kind of trying to sort of figure out how we were going to make this all work. And in some ways, the first version we heard from Neighborhood Villages was a little different from what they do today, because now they basically find any solution the field needs and they pilot it, and then they implement it, they make it better, and then the state takes it on. It's an extraordinary model. And so it's a little bit of a no-brainer for us to support the work that they do, because this lack of system, they keep just sort of saying, what's not working? Why don't we see if we can pilot something? And so the thing that we'll talk about today as one of the things that we support, the reality is we started out supporting this one particular initiative. We are now multi-year general operating fund supporters of Neighborhood Villages, because in fact funding any one initiative of theirs is sort of too small an effort in reality. But
what we say around the office is, it's easy to support Neighborhood Villages because they just get shit done. And it's true.
I almost bought a mug that says "Get Shit Done" for Lauren when we were on a family vacation. And I realized she had small children in her house, and they were just learning how to read, and that would be inappropriate. So I didn't buy it, but that is true. The thing that we'll highlight today is a COVID testing program that Neighborhood Villages put in place for the early childhood field. And it really came from hearing from providers. So know that, as we all know, March of 2020, the whole world shuts down. Grocery stores don't shut down. Healthcare facilities don't shut down. Basically everybody else shuts down. Restaurants do some takeout. And the first thing that comes roaring back to life, because it has to, is childcare. Childcare did shut down, but very briefly. It felt like an eternity at the time, didn't end up being an eternity. Long before schools ever considered having anybody in their buildings, childcare opened up again for a couple of reasons. One, because people needed to go to work, those people who had to, and they had to have, their small children had to be somewhere, but also because childcare actually can't survive if it's closed. It's unlike schools where those K-12 dollars just keep coming. That actually doesn't work in childcare. It's a largely private market. Well, so the problem was, of course, it's a private market, and therefore there's no support for a lot of the things that are needed. And the folks at Neighborhood Villages were hearing over and over again that COVID testing was desperately needed in order for them to stay open, but there was no way to make that happen. There was no, there's no school nurse if you're a family child care provider and you've got 5 people in your home, or even if you're a center. The infrastructure that exists in other sectors, and particularly K-12, just doesn't exist. And so they were hearing these pleas from the childcare world that they really needed COVID testing. And so they did what they always do, which is, well, let's just figure it out. They worked with folks at Berkeley and at MIT to come up with a pilot program, and ended up piloting pool testing for the sector over the course of 6 to 8 months until the moment where DESE announced, the K-12 agency announced that they were planning on implementing testing throughout the K-12 system. But of course, as always happens, it was like, there was no plan for childcare. How do you, and you already, right, we know the punchline. There was no answer for how to make that work for childcare. But of course, as usual, when Neighborhood Villages is involved, there was in fact an answer. And so they ended up operationalizing in partnership with the state a first in the nation statewide COVID testing program for childcare. I remember running into Sarah Muncie at one point and her saying that all these people, the governor's office, among other people, were saying, like, this can't happen. You can't, there aren't logistics, she said, look, there are logistics for all kinds of things. We'll just take them and pivot and use them. The private sector has all kinds of logistics systems. We'll just make this work for childcare. I think it was pretty eye-opening for a lot of folks. And so we've got the number somewhere, what the 120,000 people ended up, but Lauren, give us the numbers.
Yeah.
You can do it.
Can you give us the numbers?
I do have them, but.
We don't tell our chief program officer architected this entire enterprise, so you probably know them off the top of your head.
Over 1 million tests administered, 40,000 positive, and countless thousand number of days for children in care.
How many in your trunk?
We have secret
Oh.
warehouse and facilities.
We were on Zoom calls all the time where Beanal would literally be surrounded by COVID tests just in her living room. But the reality is they identified the problem, they heard from the field, they came up with a solution, but then they partnered with the state to make this happen. And there are a whole bunch of other programs that Neighborhood Villages is doing right now that is just that same model. So the reality is, if you are a child care provider, I said at one point in testimony to a legislative committee some 6 or 8 months ago that there was essentially nothing stopping, there's nothing between a provider at the state level and the commissioner of early education and care in the child care world, right? You don't go to your principal and then you go to your superintendent and there is no infrastructure. There is no school district. At the local level, you're all sort of fending for yourself, and with any luck, you've got some kind of network. But the reality is it doesn't happen for a lot of providers. And so essentially what Neighborhood Villages is showing us how to do is create what would be a school system for the early childhood world. And the COVID testing is one of many examples.
Wonderful, thank you. One thing that strikes me as you all talked, and I promise ask a quick question, and then I really want to save time to open things up to the audience. But one of the things I noticed that you all mentioned was this role of government in this space, and there's certainly risk when you think about working with government. And I know funding in this space, there's many risks, but maybe you could talk, and Elizabeth, why don't we start with you, but a little bit about the risk of partnering or thinking about government as a partner.
Thank you. It's hard to think about doing this work without thinking about government as a partner. So it is risky, but we knew that we believed in Healthy Steps and we believed what they were doing for children. And we believed that meeting families where they are and giving them what they need is the right thing to do. But we also knew that we couldn't do that for all of Greater Boston forever. And so in some ways there is a risk, yes, but that we also felt like we had no choice because that is the path that we saw to sustainability. I do think it is daunting to think about like, oh my gosh, we're going to work with the Centers for Medicaid and Medicare. We're going to work with Mass Health. We're going to work with even MGH is a big organization. And so, when we're thinking about our dollars compared to other pots of dollars, including public funds, while they may be inadequate, they still dwarf ours. And so finding the way in, I think, was more of, it wasn't the risk, it was the challenge, I think. And I find, when I talk to other funders or donors, I think sometimes that is off-putting to try to figure out how your dollar can make a difference when you're partnering with the public sector. And I think there are ways to do it.
Sure. I think we have a rare set of conditions in front of us because it's typically the case that maybe NASA and unfortunately the military are kind of the government agencies that invent stuff and do R&D. Everybody else kind of keeps the trains going and keeps the framework in place. But I think over the last couple of years, we've actually had an EEC, a government agency that has an appetite for innovation, that has some great ideas, and who's really willing to do risk match because they've got a few dollars out of ARPA and other COVID recovery funds. So we felt like we have to take advantage of that because the moment may not last for very long. So this is a period of invention. I think we also, though, have to think about what's the dot connecting work that we have to do because we really are talking about creating a system of systems in some ways. If you think about how children and families are at the center of many things, it's not just about what child care and early learning centers do. It's about what healthcare institutions do, other family serving and welfare-based institutions do as well. So as I like to say, EEC may be the world in some ways, but it's not the universe. And so I think we have to think about what the ecosystem looks like and how to bring that constellation of children and family-focused agencies together in a way that creates something comprehensive and coherent.
So that's a great lead-in for my question for you too, and then I'll open it up to the audience. And that's really, if you have government and you have all these families and young children and you have philanthropists, like what is your vision for early childhood 10 years from now? Like what does the ideal state, what can we change the world into for these families if we partner with government, if philanthropy is involved, if we have these amazing organizations that are doing great work on the ground?
It's really, it feels to us like it's the systems that are needed as much as anything. I mean, the reality is, I think if a spigot were turned on today with public dollars and we got everything that anyone would dream of, we're actually not ready for it. And so that really is the work that a lot of folks have been doing, is to help figure out what role philanthropy can play in partnership with all of these public actors to create the systems so that when we end up with enough public investment in the field to really keep it not only afloat but sort of thriving and as high quality as it should be, there are systems there so that we don't end up with this situation where if you're, again, a family child care provider, you're calling the commissioner directly when you've got a problem.
I think that's right. I think we have a quote in our office. It's a Milton Friedman quote about policies lying around in sort of times of rest that sort of get, they make the politically impossible the politically inevitable. And, this is a time that we've all talked about as being sort of a time of harmonic convergence. And, there's a lot of attention now on early childhood, and it's time to sort of to blend the risk capital question with this answer. It's time for philanthropy to help to craft solutions with risk capital that can then be sort of implemented in a system of the future. But if you don't have those policies lying around, when the money comes, there won't be any place to put that money. And so our vision for the future is, yes, a system, finally a system that is coordinated with infrastructure that can help sustain the work and can support families on the ground.
I just had one other sentence, which is a little bit going rogue, and I know we're at the end of time, but I can imagine a situation, if we had been sitting in this room 5 or 6 years ago, all of this system level stuff may have seemed very bigger than we thought we wanted to be involved in. And the reality is there are lots of ways to get involved. I mean, it just turns out that this particular group is thinking about systems and policy, and you've heard a lot of advocacy, and we're all doing advocacy in different ways. It feels really important, but there are lots of ways to get involved that are much more direct service on the ground without an initial obvious way to connect it to the larger world. And I just sort of want to acknowledge that, because I think some of this can seem a little arcane, maybe.
Well, and what you're prompting for me, and what Ron prompted is that there are partners out there who want to work with philanthropy. There are people in the public sector who need help with the case making, and so philanthropic dollars can help them make the case for the right systems change. There are other funders who really want to make a difference that you can brainstorm with. We benefited tremendously from our partnership with the Smith Family Foundation and the Klarman Family Foundation, but now there's the Early Childhood Funder Collaborative. So there are other partners to think with. There are community voices that can borrow, use, stand on the platform that philanthropy brings that can tell the story of what families need and want. And so as I listen to the conversation, I think, yeah, it's daunting to get in because it's kind of opaque, but there are partners out there that want to do the work at every level. There are families, there are public sector folks, and there are your fellow funders. So I think maybe that mitigates the risk, just to go back to the first question that you asked me.
No, I think that's a great way to frame it. So I do want to give folks in the audience a chance to ask the panel some questions. Why don't I open it up? Any questions? Oh, please go ahead.
Thanks for sharing all this great information. I'm new to this space. Our family has started really shifting most of our funding to prioritize community-based organizations. Can you lift up some stories or examples of some of the community-based grassroots organizations that all of the work that you're doing is, supporting?
So the question was about community-based organizations, and just asking if the panel could provide some examples and lift up those organizations and what they're doing. You want to go?
So Healthy Steps is a national organization, and we're working with MGH. And it's MGH Chelsea, so it's a little bit different. But I'd be hard-pressed to describe that as a community-based organization, although I would say that the way they have hired the specialists and connected to Healthy Chelsea, which is a community collective impact group in Chelsea, I think does give it a community-connected strategy. The place for us, and we have more coming in FY23, so watch this space in FY23. But I'd say the place for us where we have the closest community connections at this moment in time is in our workforce strategy, which I haven't talked about. Like the Commonwealth Children's Fund, we invest in family child care providers because they are, for all the reasons that Ron described and Melora and Lydia described. And so there are places like, again, UMass Boston, which isn't grassroots, but is working with individual providers. Shared services at the United Way, also not grassroots, but working with grassroots organizations to actually build business functions with family child care providers. But there are providers out there that are, living hand to mouth. The director is not taking a salary that I think would be the epitome of not only grassroots, but, a community institution. So they are there.
I'll just mention, and Brian Spence is in the room, I'll mention Ellis because we are an Ellis investor. Ellis had the idea that they wanted to expand the number of seats in their portfolio in Jamaica Plain. And so we said, yeah, you've always done good work, so let's help you expand that. But we also knew that they would be C3 grant recipients ultimately as well. So, we're trying to think about this at two different altitudes.
I can provide one other example. I'm on the board of an organization called RACA, and just as a comparison to providing care on the ground, this organization works with mothers around the premise that if you stabilize the mother and the family, that the children will also be stabilized. So it's working with extremely high-risk, vulnerable mothers. And I think that goes back to the points that we made earlier, that early childhood really encompasses kind of a broad swath of different organizations and people doing very different work. Please.
So as a novice in this field, I know very little. it's kind of overwhelming to understand like where to go and how. I mean, there's some wonderful people in this room. We've talked about it a little bit over time, but how does someone, whether they're a donor from one perspective or someone who's experienced this, navigate their way through this field that just seems so like many different parts and pieces that all kind of weave together to make up, early childhood, which in itself is a strange name to describe a whole bunch of different functions. And so, to get to understand the lay of the land, like I know we can sit down and chat about it, but how do most people sort of get to know the field and understand like where to even start and then move through it to get a better understanding?
So the question was about the kind of breadth and depth of the field and just the feeling of overwhelmedness, and how do you start? How do you navigate the field?
You made him come, so.
I know. So, I mean, Brian, I think you asked both, if I heard it right, both if you're a family, what do you do, and if you're a funder, what do you do? I think, let me just make a plug. If you're a funder, you join the Early Childhood Funder Collaborative, and you because now we actually have a place where we gather. I mean, that it's a shameless plug, but that really is why it's there, because otherwise we were, I mean, again, as we were sort of riding on the coattails of some folks who really knew what they were doing, otherwise there was sort of nowhere to go, and there was not a centralized place. So that really is part of the answer. And having conversations with folks who are doing it in all kinds of different ways. So it is a way to navigate the field. If you're a family, good luck. I mean, right? I mean, that is the problem. It's the reason that we are doing the work that we're doing, because somebody said recently that, you get all this training on how to give birth. You didn't, but Stephanie did. Got a lot of training on how to give birth. And then you get handed a child, and basically the system says, we'll see you when you're 5. That's ridiculous. I mean, it's preposterous. And if you move to a town and you have a 7-year-old, at least to go to the school department, right? I mean, there's somewhere. And apart from pediatrics, which really needs to be one of the key systems, and that answer is a wonderful answer, there's no other system. And so helping to create that is sort of what we're all in the work of doing right now, and it doesn't exist yet.
I'm not interrupting.
No,
okay.
go.
The other thing I'll say is watch this space, just like you, because there's a project of the Early Childhood Funder Collaborative that we are calling EC 101, which is basically it's going to be a website. We've hired the Rennie Center to help us create this thing. It's going to be a website that describes the landscape of the early childhood ecosystem as it exists in Massachusetts today. And it will be a map of all of the things that we have been talking about. It will just enhance everyone's confusion, because you'll see how complicated it all is, but at least it will sort of be in one place. And it will be backed up with data, and hopefully will be sort of a living and evolving place to sort of get the lay of the land and to learn how you can plug in, when you're interested.
And I'm actually going to call on one of our audience members here who was an early adopter in this space. So I feel like you have some ideas.
Completely in the same boat as you were. And I've been at it since 2015. And only now am I getting clarity, thanks to all of you all. So it's a journey. I would also say, to your point, proximate and community, maybe if it's Epiphany, Ellis, Nursery, which I sit on the board, they need your skills and resources. That proximity to the families served and to the leaders that are trying to make this work, you're going to learn in a year more than you ever want to. So that would be my suggestion.
We went into LA, Boston, for the first time at an historical moment, just nominated the director for early education. So there's a lot happening there too. And just this Sunday, she was at the zoo, gave the feedback from families on their experience on how to navigate child care system. So she's listening from the people to innovate. And I think as innovators, we need to listen to the communities and what their needs are, and innovate, and not just, hey, there's this research that we implement that we can see if it's going to work, but more of like listening to them, and a lot of that is happening. Can I offer one? I'm sorry. to you on the Apple podcast. I'm only saying that so you don't think it's like me or mine. But it really gives a tight, how did we get into this mess? What is it like to be in it right now, and where is it working? And then what can we do about it? So anyway, for easy, fun listening, no one is going to say less.
Fantastic fun.
I will definitely second and third that it was one of very enjoyable if you are interested in this stuff. Please go ahead.
I think it is overwhelming, the issue, and I think that comes from, there's some pretty major injustices at the root of this issue, including racism and sexism. And when we think about I think about the mostly women who are in these roles, mostly women of color, at least coming from the community-based organization perspective, and I think about these incredible women that are doing this work with young children. And there's obviously, from the intros, there's a lot of parents in this room and a lot of professional leaders. And I think for most of us, we would agree that the most important hire we have ever made in our entire lives is that person who takes care of our little ones when they're at that age. But it's not seen as such a critical role as it is. It's the most important job you can have. It's just, and people aren't valued or compensated for the work that they're doing. So it's so overwhelming, and I think it makes sense. And I think as we think about, like Josie's question was great, how do we support these community-based organizations, how do we support these leaders who are educating our young children, that is just a huge piece of this.
Please.
Question is to build on that comment because it speaks to the need for culture change.
Yeah.
And that there's advocacy, there's policy, but there's a cultural shift that has to happen. How we see the educators, how we think about women in the workforce. How can philanthropy invest? What are the opportunities to invest in culture shift? In an area of change.
And it also goes to how we give.
Can I add a comment on right before? Because I totally agree. And to Brian's question, I would answer your question to say that we got into the space, I don't know, we've been doing early at Catholic schools for like 10 years, right? But we just opened a new center in Dorchester, or reopened the center of St. Mary's Women and Infant Center. And we talked to a bunch of providers, and we asked them to run the center, and they all said no because. And that's the cultural shift that needs to happen. So we said, we looked at the business model, we said we think we can do this, we think we can do it different, and we think we can do it in a cost-effective way that serves a variety of families, and we're doing it. We're opening the center in 2 weeks. And so I would just say, when you do your due diligence, be aware that the culture shift needs to happen from current providers who have that can't-do attitude, which is, I think, just a realistic perspective for a funder getting into this work, that people aren't going to say it.
Can I add one thought onto that too? And that's that I think one thing that's maybe a little bit exciting about this space, as everyone was speaking earlier, there aren't very many systems around this space. And so it's actually an opportunity to build those systems in an equitable way, in a way that does support people of color, women, and we've never had that. And so this is actually a moment for early childcare to think about how we build those systems in the way that we're talking about.
Perhaps one of the greatest inventions in early childhood in Massachusetts over the last 2 years has been the 9:30 call. Strategies for Children's every morning call. Now it's Monday through Thursday. Can be anywhere from 50 to 100 plus advocates, providers, folks from all over the spectrum of the market and sector, creating room to learn from one another about what's going on. B, creating some room for imagination as well. When you talk to providers, there's not much time or room for them to think beyond the opening of the doors that morning, the closing of the doors that night, and what's going to happen tomorrow. And so if we're going to create a different system, 2.0, 3.0. I don't know what release we're on at this point. We need more of that white space room. The 930 call is one of the places for that. It is also a place that I think is addressing some of the risk culture among providers, because there have certainly been times when things happened and everybody on the call clutched their pearls. We can't do that. We can't do that. But to have then the next morning to talk about it, to have the neighborhood villages team come on and say, well, you know, there are a couple of ways to do this, and we're starting to plot and plan this out. Now people are starting to have the experience of inventing with one another and creating new possibilities. And the 930 call has been fuel.
Yeah, and you know, Katie, I think that story is so powerful because I think that's what philanthropy can bring. As much as money, which is really helpful in this financially starved sector, you know, when we talk about the way the funding works for early childcare providers, pre-pandemic and maybe post, the funding is based on attendance. So if your kid doesn't come to childcare, the childcare provider does not get reimbursed for that day when we're talking about a subsidy, right? So kids get sick, kids stay home, kids, you know, so we're just keeping them in this financially perilous place, and the system is designed that way, right? So it's a logical behavior. It's a logical response, I think, for them to be like, oh, no, it can't work, it won't work, it hasn't worked. And I think for philanthropy to be able to come in and say, no, this could be different. I actually think that's part of what philanthropy brings to the table. And so I think it's really important to name it as you have, but I also think that's part of the reason to stick with it.
And I do have just to add on to her, like our end goal is definitely to create predictable, consistent, healthy, positive, and thriving environments for community of families. And then we hear every day from providers that you have to compete for funding. You have to give you. And as we know, our applications and our distribution process is humongous. How are we all coming together to make that easier for them so they don't need to hire all of these people just to fundraise? And actually, a lot of these fundraisers, if you don't know, I'll talk about Ellis, they're in the classroom because they don't have staff. Right. So how are we, as philanthropists, just streamlining the process to make it easier for them? What can they do to have access to this funding that they don't have to jump over hoops? And it goes to everything else. Like when there's a new policy, they need to change. When there's change for little kids, they don't know how to adjust. So there's a lot that we got to think at the end goal, right? So if we have this great idea, how is it going to translate to the children? And that should be the first thing in our head.
So I think that's probably a wonderful thought to end on, is keeping those children at the top of our head. I want to acknowledge that we've already kept everyone over by 8 minutes, and I apologize. But this conversation was honestly so fascinating and so wonderful to be back in the room with everyone. I would invite you afterwards to continue the conversation. Just a few kind of final thoughts that I want to point out. The projects that we highlighted here today are working at a pretty deep level. If you're familiar with the philanthropic space, one might call them systems change work, which is really about kind of changing the underlying system in a fundamental way, or building the underlying system. And we chose them because we wanted to show that really a small amount of capital can really go a long way in this space. But I also just want to acknowledge that for most of these folks here, this is their full-time job. This is what they're doing every day. And in a space that's pretty starved for capital, this is not the only way to engage in the field. We talked about a spectrum of different pieces that come together to make the field of early childhood, and so funding may look like supporting your local childcare provider or in-home provider. There's a wide range of ways to fund in this space, and it's really kind of a spectrum of what people are working on. But if you do want to get more involved, I do want to point out Brian Gold at the back. He is at the Massachusetts Early Childhood Funders Collaborative and would be eager to talk with anyone. And I also want to highlight Ron is with the Business Coalition, so that's another place to get involved. And then also, any of us on the panel, or probably most people in the room, would be also willing to speak with you. Thank you all for your time here today, and we're really hoping that more people will want to jump into this rapidly evolving field. So thank you.